All right, and we are live. Okay, so good morning, good evening, good afternoon. It's your girl here, and we are live. So, welcome to everybody on YouTube, LinkedIn, Facebook, and TikTok. We appreciate y'all joining us on this Good Friday evening. This is the last day in July. Can you believe that?
I know.
This is
I'm
the
still in
last.
January.
I
Can
know, right? It's like, can I get for me, the summer is over because I'm back to work, but
right.
can I get my summer vacation back? Like, what happened?
It's
But
flying
nevertheless,
by.
I know. And it is Leo season. So to all you Leos, I'm a Cancer. I be teasing. I didn't realize how many Leos I am friends with. I'm like, everybody on my timeline is a Leo. What happened? What is going on? What is going on? All right, so good evening, everyone. Let's get this thing started, and welcome to another episode of Meet the Clinician. And I'm your host, Larneka Lavalais. I am a licensed professional counselor supervisor and the owner of Larneka Lavalais LPC PLLC. And tonight, I'm excited to introduce our special guest, Dr. Krista Lewis. She is a board certified family and psychiatric mental health nurse practitioner. Dr. Lewis has experience providing care in inpatient, outpatient, and telemedicine settings, helping individuals manage ADHD, anxiety, depression, mood disorders, insomnia, I might need to call you, and many other mental health concerns. What makes her approach unique is that she combines evidence-based psychiatric treatment with holistic strategies, recognizing the important connection between mental and physical health. Please join me in giving a warm welcome to Dr. Krista Lewis. Thank you so much. You know what? I know you're busy. I know you're busy, but I do appreciate you so very much for coming out this evening and joining us for Meet the Clinician. How are you?
I am doing well, and thank you so much for that warm introduction. And I appreciate the offer to come here and speak with you all tonight.
Yes, yes, my pleasure, my pleasure. So basically, the platform, we just want to get to know you. Who are you? We as clinicians, many times, we're in the office, we behind a computer, but who are we and what influenced us to actually choose this line of work? Our passion, these different things. So let us start off with tell us a little bit about yourself. For those who may be meeting you for the first time, tell us a little bit about your background and your journey here.
Well, I am just a little black girl from Mississippi
Okay.
that aspired to work in healthcare. I was nursing for years, and I ended up psych nursing like the end of my career and moved to Texas. That's how I was able to get here. Was I was working at one of the psych hospitals, and so that transition into me. I was already in family nurse practitioner school at that point, and looking back on things, I can see how I ended up in the mental health field. It
Okay.
was signs along the way, like just talking to people in the grocery store and things of that, just being that listening ear. But I remember working, like my mind was set on doing family. I wasn't trying to do psych, as far as like a psychiatric nurse practitioner at that time. But
Hmm.
I was working in family, and I realized, that your physical health also correlates to your mental health. It was plenty of patients that, I was managing their diabetes, their hypertension, and chronic pain, and their emotional health was being neglected in a sense. And so that inspired me to go back and, visit my roots because, like I said, I was a psych nurse for a few years and get my psychiatric nurse practitioner. And now I own PMB Wellness, where I do my
Okay.
own psychiatric evaluations, and I also teach.
Okay.
So yeah, I'm teaching future nurse practitioners, psychiatric nurse practitioners to go out into the world. So that's kind of how I transition. I don't know if I sped it up too fast for you or
You good. You good. I'm gonna bring you back over here. I'm gonna bring you back over here. So you are from Mississippi.
yes, I am born and
Okay.
raised
Then all
Brookhaven,
right.
Mississippi.
Say it again.
Brookhaven, Mississippi, right outside of
Brookhaven.
Jackson.
Okay. Okay. Good. 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 So, man. Okay. I met you online. So I always tell people how I know folks. I met you online because I was working with an organization that was trying to set up a mental health fair or something. It was
Mm-hmm.
something. And we ended up getting rained out. And then I sent you an invite to something my cousin was having. And you came. That's how we met once in person. Yes.
Yes.
Yes. So Mississippi, so you are a nurse by trade. Your initial everything was in nursing.
Yes.
Okay. Now, what made you want to do nursing?
I remember being 5 years old, and my mother asked me what I wanted to do, and I just said I wanted to be in the healthcare field. And so it transitioned from different areas of healthcare, but I was stuck on nursing. Like when I went into my sophomore year of college, I
Mm-hmm.
transitioned over and I worked in several fields in nursing, and I just found that that's where I wanted to be. So, and I feel like it also gives you that compassion you need in the healthcare field when you're working in nursing.
Okay. Okay. And so from there, you ended up with a position that brought you to Texas.
Yes, I did.
Okay. Okay. And so for um psychiatry, you said you realize how everybody, your physical and your mental pretty much go hand in hand.
Yes, yes. I feel like, if you are having trouble with your diabetes, you go get assistance. If you're having trouble with your blood pressure, you go and get that checked out. And so it seems like with mental health, that seems to be a little more neglected.
Mm-hmm.
And I wanted to be a part of making that change where people feel comfortable coming to see and getting their mental health checked.
Okay, okay. Because the funny thing, we forget about that. You know, I am dealing with, I don't know what I'm dealing with, child. I know my shoulder is frozen. It could be menopause, it could be thyroid. I don't. We trying to find out though. They trying to, they're trying to figure all that out. And so in me, I'm a researcher and I'm gonna research it. If anything going
Hmm.
on, I'm gonna go look it up. What is going on? Maybe to my detriment, but I'm gonna look it up. And one thing that I saw when they were talking about frozen shoulder, they was talking about trauma and how grief and how the different things are in your body, like you
Hmm.
carry these things. And so I'm curious, as you were treating, the different patients for, different medical things, if that was something that came up about maybe some traumas or some things, they're dealing with diabetes, but they had some other stuff that may have occurred that was affecting them.
Yeah, I have several clients that come in. Like, for instance, I remember treating a gentleman, and he had this stomach pain, and we done all kind of tests. We prescribed medications, and everything came back normal. But he just had this stomach pain, and eventually we realized it was tied to depression. Because a lot of people think you have to be like crying all the time or actively
Mm-hmm.
suicidal to be depressed, but it could be somatic symptoms where it's just a stomach ache, or you're having not to veer off, but like diarrhea, things of that nature that's like making your nerves just run, things of like that.
Mm-hmm.
And so migraines, it could
Ooh.
be any kind of physical ailment that can trigger it. So that's why I always say, it's good to get it out, process it. Otherwise, it's going to manifest
Mm-hmm.
into some kind of medical situation. I've seen elevated blood pressures due to anxiety that's not being treated and things like that.
That part, we miss that part. We totally miss it. Because either my physical is physical or my mental is mental. We really don't bridge that gap to realize, oh no, they go together because all of that is us. My
Mm-hmm.
head and my toes are on the same body. So
Mm-hmm.
anything that's going on between it, all that is relevant. All of that is me. So that part. Okay, okay. So that leads us to the next one. What clients do you most enjoy working with? Do you have like a certain group? Because you got ADHD, we read in your bio, and then you have really a gamut of things that you work with. But do you have any particular uh, clientele, and that you enjoy working with?
Um, I noticed that I do see a lot of clients like after birth where they have postpartum anxiety, and I do enjoy that. just because it's not something that's often talked about. You hear about postpartum depression, but and especially when you experience something yourself, you can relate to it. And so I find that I do enjoy that. I enjoy just regular anxiety that people may experience, kind of helping them walk through that. And I was thinking about it when I don't know exactly which one I would pinpoint would be my favorite.
Okay.
Yeah,
Okay.
I just enjoy helping people and seeing the transition. I think that would be my favorite. Seeing the transition from, sometimes these people or anyone can be at the worst point of their lives, and seeing them transition to where they can feel like themselves again, interact with
Yeah.
their family again, work, reach their goals. So that would be my favorite, just seeing my client transition.
Okay, now tell me about postpartum anxiety, because I know like you said, we are used to postpartum depression. I do recall somebody mentioning that, like kind of briefly. We didn't stay on it, but tell us a little bit more about that one.
It generally presents more like control and aspect, like they're not sleeping. They are more anxious and worried about, something going wrong with the baby, or they have to be up 24/7 just laying eyes on the baby because they're aware they're going to stop breathing. Or, they have intrusive thoughts that are anxiety induced about, doing something wrong or they're not doing enough. It could even range from them not allowing people to help them because they do it best, or we do it best, or however you want to put it, when you're doing the care for the infant. So it's less of like what they screen you for, as far as like, are you having thoughts of harming yourself? Are you having thoughts of harming your child? They're more protective, where they are hyper vigilant, you
Yeah.
know. So it's more of that aspect. And reason why I know is because I remember going 29 hours without sleep because I wanted to make
Oh,
sure he was breathing.
look
And
out now.
my doctor sent home a prescription, was like, look, you're gonna have to help without, if she tell you no, you're gonna have to help because she's just,
Yeah.
not sleeping, and that's not well for her. And I had to learn that on my own. So I guess with me actually experiencing that, and I can even empathize with it with the client, it helps them along their journey because they're like, I'm not crazy. I know,
Yeah.
because that's one thing people don't want to open up because they feel like someone's gonna think that they are,
Judging.
crazy, for lack of a better word. And so just to know you're not alone, you're not the only person that experienced it. It kind of helps them open up to the treatment plan.
That part indeed. Excuse me. I know that a lot of people who have chosen this path, to work in mental health, often have had their own stuff that they've
Mhm.
dealt with. A lot of times they feel like, they've experienced things and they were able to overcome it. And so I want to help others. Or maybe someone close to them experienced some stuff. And it's like, wow, I see how that affected them. And so I want to help other people, to overcome that. But I have found, in my work, that all of my trials and tribulations, Lord, that I have experienced, that helps me to connect with my clients, you know. Because, like, although our experiences may be totally different because we're individual people, but I do understand anxiety. I
Mhm.
understand grief. I understand, medical stuff and having anxiety, being hypervigilant because you've had some medical diagnoses and whatnot. And so, I mean, I get it. Yeah, definitely helpful. I mean, we
Yeah.
don't want it, but we've had it, and so we, can help others through it.
All right. And that's what I found with my clients. Like, just the start of it is feeling understood and heard.
Yeah.
Once they feel heard and understood, they're willing to open up and kind of let you know like what exactly is going on, so you can help them to the best of your ability. And I love the collaborative approach. I want them to be able to tell me, what do you feel comfortable with? I can give you the options. I know how these work in theories, and we don't
Mhm.
necessarily have to do psychotropics. I'm open to like holistic realms, as long as it's safe. But I just like to give them the option to come in and we can listen, discuss, and go over it as a team.
Okay. Okay. One thing I want to throw in there, I thought about, sometimes I have some stuff that's not on the paper. When I do a lot of outreach and I am talking to anybody, you name it, I'm gonna be at the church, at the school, I'll be on the corner, wherever I can advocate for mental health. Y'all want me to come, I'm going. And people have a misconception of what, I guess, for on my end, what therapy is, right? Because they may see their doctor and they feel like that's therapy. But in essence, most of the time, the doctors are just kind of talking to get an idea of symptoms or whatnot so they can prescribe medicine. Sometimes the clients feel okay because they, like you said, feel heard or felt understood. But, that's not the work that we do. So if you could explain the role of a psychiatric nurse practitioner, how does that differ from what I do maybe as an LPC?
Like I always tell my clients, we're complimentary to you all.
Okay.
You all do the work and we come in to complement. Now we can do some talk therapy, supportive therapy, and some of my colleagues have extensive training where they can do like full therapy sessions. But I'm more of a medication manager, management. So
Okay.
that means I prescribe medications after I do a complete psychiatric evaluation if they're appropriate. Sometimes that may include some supportive therapy, depending on what's going on with the client. Sometimes we do a bridge with some therapy sessions just until they find a full-time therapist. But
Okay.
we're more of the medication management component of it, where we provide different types of treatment, whether it's antidepressants, mood stabilizers, like I said, if it's a holistic, natural supplement. So that would be the difference.
Okay. Okay. And I definitely do not prescribe any medications. If anything, if I feel somebody is in need of medication, I'm calling you.
Well, I will say this, like I tell them, if you don't do the work, what I do is just like putting a band-aid on an open wound that needs to be debrided.
Yeah.
So, and the symptoms will reoccur. They're not, you have to develop those coping skills. And so that's why I say we're complementary to you all, because that's where the work begins. And then, like, if they need some assistance, we come in and kind of assist so they can kind of take the medication and help them process and learn those coping mechanisms that they need to live a healthy life.
Definitely. Definitely. I can say without saying, um, I can appreciate collaborating. You know, there have been some folks that, we've had to collaborate on, and you have helped me to, understand some things that I was unaware of because they may have shared some things with you that they may not have shared with me. And so I think that, that can be very helpful whenever we work. I know a lot of times in this profession, sometimes people feel competitive, but child, you got to collaborate with folks. If the main goal is making certain that our clients get the care that they need, we want to see them get the healing that they need to be successful, to manage whatever it is that they have going on. You got to work together. You got to work with people. I don't know everything. I don't everything is not my niche. I will refer out. If somebody has more knowledge of something than I do, by all means, I will refer out or collaborate with some folks to see what we can do to get them the treatment that they need.
All right.
Yeah. All right. So how long have you been working in mental health?
And mental health, since 2014.
Okay, okay. So from what you were taught in school, because it's always a thing, we go through the theories, we go, and I know y'all stuff is way different, but we go through the theories and different things, and uh maybe ideally of what the clients look like, what they're them coming in, and different uh issues they may have, disorders or whatnot they may have, and how we treat them. um for me, I know it's like a bit different because real world stuff and people are different than whoever they were talking about in these textbooks. The people that I'm seeing, it's different. So for you, has that been similar? What has working in the field taught you that school couldn't, or maybe you learned something different that they didn't teach you in school?
Um, There's so many instances. I also will say school teaches you the science behind like diagnosing and like the disorders and things of that nature and the treatment for the illness. But what you have to learn is that each client is uniquely different. You know, it's not going to be textbook. They may say, oh, well, you do this procedure, and that procedure. But when you're working with a client, you just have to go with the flow and be, um, I will start about like you say, listening for them, but the importance of it is just like knowing that no two people are the same. I know
Yeah.
I'm rambling. I'm trying to get my
No,
thoughts
you good.
together.
You good. You are
But
good.
you got to learn without judgment, meet people where they are is where I'm trying to get with it. You can't just go by what the textbook says. It's not always black and white. There's a big gray area in between. So that's one thing that I've learned. And then just learning that you have to have a caring heart going into this. It's not something
Yes.
you just do for the money. It's a lot of experience that you will have that you just have to have that passion in it for.
That part indeed. Because if you coming in for the money, honey, on our end for sure, you're gonna be disappointed. You know, and if that's your motive, being in there with the people, well, they gonna yeah, they're gonna pick up on that. The connection will definitely be a little difficult for sure. Yeah,
And you just have to learn how to build the trust. That's one thing they can't teach you. It's either there is not how to build that rapport with a client. They can give you a textbook explanation of that, but you have to learn about interacting with the client, reading their cues, learning what they like and what they don't like. So, and
hmm
then letting them in with you so they know that they can trust you.
that part.
If you just sitting there asking them textbook questions, then I'm like, they not worried about what's really going on with me and kind of shut down.
That part indeed. Sometimes you just have to talk. I was talking to someone. I talked to so many people. I forget who I'm talking to, child. I was talking to somebody, and they were expressing about a child that was like the kid. They tried therapy, and a lot of people with teenagers feel like I don't know. They don't. I don't know if they're uncomfortable talking to them. And I've been in education. My 9 to 5, or maybe I should say my side hustle is education. Okay. And so with kids, you can't treat a kid the way you would an adult. They're different. And
Hmm.
so I was telling the person like, yeah, I usually just kind of I'll ask them about their music if they're in the sports. I'll ask them about something that they enjoy, and that'll be a way to connect. I'll find some kind of way. If it's a music, I'll talk about my music from the 90s. They probably like, who? Johnny Gill, who? What? And it'll be a joke just to make them comfortable until they feel like they're ready to open up and to be able to talk. So yeah, that's nothing that they taught me in my university about that part. That's something, that's a skill that develops over time. If you like people, you can talk to them. I know when we would have our classes, they were like, don't do this and just do that. I'm like, child, look, now not nothing unethical, I'm just saying the way
Right,
you
I know what
build
you mean.
rapport. Because I want people on here to be like, she did what? No, they're building a rapport. I might talk about, oh, the Super Bowl that y'all, I won't talk about politics because I ain't trying to do
No,
that.
me either.
But I may spoil. Oh, the FIFA was just here. Did you watch it? No, but I seen the people going in the restaurants and they seem to have a good time with the food. That
Hmm.
could be a way to make that connection. Just having conversations until a person is comfortable and
Hmm.
feels safe to be able to start talking with you and you can work with them. Yeah.
I agree. I agree. I've had my share of conversations. I remember one about Legos,
Uh-oh.
just because that was his passion. So, we talked about it and he was comfortable. I saw him open up and just kind of shine. I was like, okay, I know where we need to go now.
There you go. There you go. Indeed. All right. So our next question: why do you think mental health still has this stigma? If you look at most, I won't say most. There's a lot of programs on TV or movies where somebody's gone to therapy. They're in therapy. Somebody's talking about anxiety, panic. I mean, the words are there. The the content per se of the idea of going to therapy is there. You listen to some music, they may talk about it there. All the big influencers and folk, Oprah and all these people talk about, well, fixing your life. That's a whole nother thing. But just different things are out there where I can say, child, at least 30 years ago, when I was in high school, 30 plus, when I was in high school, you didn't see all that. Maybe a movie, maybe a Sigmund Freud type person, maybe a psychiatrist, but they were typically in a mental institution. Somebody may have been institutionalized in a movie, and you had the white coat person walking around, giving them shots. So that was probably the most that we were introduced to in pop culture in regards to mental health. But today, you see a little bit more. You see, I would say, and maybe I'm looking for it. Maybe I'm the only one looking for it. But you see a lot more, but yet people still is a stigma in regards to mental health. Why do you think that is?
I think the stigma still exists because mental illness is often misunderstood. Like they talk about it, but I don't think they understand it fully. We can easily see a broken arm or high blood pressure, but you can't always see depression, anxiety, PTSD, or bipolar disorder. And so some people grow up there asking for help. That's like a sign of weakness.
Yeah.
But I think in reality, it is a sign of strength. And so I feel like as healthcare professionals, we can reduce that by creating safe spaces for them and things of that nature. But I feel like most of it is just because they don't understand it fully. They're not, even though they're talking about it more, they're not breaking down the diagnosis. They're not explaining it, even though you're not having crying spells all the time or you're not actively suicidal, there are other signs of depression and, there are other signs of anxiety, increased irritability and things of that nature. So I feel like if we do more education and, make it more of the forefront that it's a strength to seek help. I can't speak today.
That's all right, girl. You've been working all day. It's quite all
right. No, I can one-on-one is fine, but when the cameras turn on, it's like I get
just ignore it like it ain't even.
We
FaceTime each other. That's all.
But yeah, I feel like just putting them out there that it's more of a strength than a weakness to seek help will be more of a help for them.
Okay. Now, one thing I have found on my end, once I get the people in, they are reluctant to go to medication. And I don't push. I try a lot of advocating for it, or at least for the idea of getting an evaluation or an assessment to determine if there's something that's needed. Because for us, we can't truly give I don't know why we can't, child, but our evaluations are not held to the standards as you all or a psychologist, I guess, because of the level of where we are. But the same assessment reads the same, But nevertheless, one thing that I typically do, a lot of and understanding, like I said, I don't push, and I may do an evaluation on my end, and I'll let them know, like, hey, I'm doing this. This is what I see. But somebody who have a little more knowledge of, what's going on and can maybe take it a little bit further. If your score is, XYZ, then I would like to be able to make that referral, to someone, and I have to give the whole spiel about it's a doctor. It's like if you needed a cardiologist, you would go. If you needed a dentist, your gynecologist is not going to pull your teeth, that kind of thing. But I'm just curious, like, why the medication? Like, it seems like a fear. I don't know.
Well, I have a lot of clients come to me telling me, I don't want to be numb. I don't want to be zombified. And I have to explain to them that is never the goal of the medication. And it's never the goal starting out for it to be long term. If you are feeling numbness, that means we need to make some changes. And the goal is to never change your personality. I want you to still be you. If you're anxious, I still want you to be anxious, but the medicine is there to slow you down enough to process the anxiety and not go down rabbit holes or, have full-blown panic attacks. works. So it's more of an education thing with the medication. And once they learn, like, okay, that's not how I'm supposed to feel, or, that's not the goal of this. This is what it's supposed to do. They're more willing to, discuss treatment plans at that point. But it's been a lot of, people hearing that, oh, I felt numb. I felt like I didn't have any emotions. I couldn't cry. I couldn't do anything. And that's when we step in to do an assessment and say, okay, we need to make some changes, either a different medication or a lower dose. And then I always tell people too, like, coming into it, our goal is only to stabilize you. Once you're stabilized and you're in working with therapy in tandem, learning the coping skills, then we'll discuss when you're ready. Once we find a medication that works, when you're ready to come off of it. Now, once they coming off of them cold turkey, I'll take you off of them safely. But at that point, we would discuss like how that would work. And the only time we recommend like having maintenance dose for a long period of time is if you've had like 3 recurrent episodes, because sometimes your body will develop tolerance to the medications and then it may not work like it did before. And so then we're, trying to find something else that works best for you. So that's at that point is when we say, okay, you may want to keep a lower dose to kind of keep you at your best.
Okay. So I guess I'm curious because I always thought once you're on medication, that's for life. Like blood pressure, child, they put me on these blood pressure pills. I'm gonna take it till the Lord say, "Go on, get out of here," because that's where I am. Mine's hereditary, and child, I done lost weight, gained weight, lost weight. Don't eat this, don't eat that. It's still, it's something that I have to deal with. But is that, people can get off theirs?
Let me clarify that. Now,
Okay.
if it's schizophrenia or like, chronic disorders that require long-term medication, that's different. What I'm
Okay.
speaking of is situational anxiety or adjustment disorders and things of that nature. A client who's recently gone through a divorce and they're depressed and anxious, things like that. Um, more situational or in the moment. Now, if it's schizophrenia where you having to control like your, hallucinations and things of that nature, you need to keep your medication. That's why we had a long acting one. So let me clarify that portion of it. But what I'm speaking of is most of the clients that come in with situational symptoms where they're just feeling depressed and things like that. It is possible, or like even postpartum disorder, like depression or anxiety. Like once they stabilize, I've have clients that successfully stabilize, and then I titrated them off their medication, and they've been fine.
Okay. Okay. I just wanted to throw that out there. But
Yeah.
yeah, thank
Yeah,
you.
for me, thank you for letting me clarify that.
Thank you for that. Also, I get a lot of people when the conversation comes up about possible medication and they go to their primary care physician. um, I always suggest that they see a specialist, someone that's in psychiatric medical something, psychiatrist, psychiatric nurse practitioner, something or the other in that respect. Because, like I said, my gynecologist is not pulling my teeth, but there seems to be a fear when we say go to psychiatric. Like they'll get the man if the primary care physician does, everybody kind of does a screening now, or if they go in and they say, hey, I had a death in the family, or I had a loss in some kind of way, and I can't sleep, I'm all nerved up, and they give them something, they think, okay, the end. Is that always a good practice? And why do you think they're afraid to go to the psychiatric for the medication?
Due to the stigma behind, coming to a psychiatric provider, and then a lot of them, they don't want to have to share their story again. Their family practice provider may, treated them for years. They know them, they know what's going on with them, and so sometimes they would prefer that. But working in collaboration with primary care providers, they kind of transition them over too. They're only going to do so much when then they'll refer out.
Mm-hmm.
So,
Okay.
but I think it's more of the stigma behind it and having to retell whatever's going on. Just like when I have clients, they have built their rapport with their therapist. I find that they have trouble with if like something happens, their therapist move or they're no longer taking their insurance. Like I have trouble finding them another provider because they just don't, they shut down. They don't want to have to go through and do all the initial work again.
Yeah, and that can be tough. That truly can be tough, and that's understandable. Um, yeah, because many times we have our doctors for years, and like you say, they know everything about us, and they know what we've dealt with, and they have to try to explain that. And now I need a psychiatrist. It's like, oh my god, but I try to use wording like this is a specialist. The same way you would if you had heart trouble, you go into a cardiologist or an endocrinologist or whatever you have to, go to when you want to get your hair done. You're not going to the Dollar Tree unless they start doing hair in the Dollar Tree, girl. I don't know. You're going to a beautician. You're going to somebody who specializes, and hopefully they got a license or something, or they know, they ain't gonna mess you up. You're going to that. So I try to, you know, use language that's soft to help them to get over the fear or the stigma in regards to seeing someone that, uh, I would say that's a specialist that could help. Because if I want to have whatever going on, if I'm going to take whatever medications, I want to make certain I'm getting the right one, what I need, and somebody that specializes in it. Yeah, I might get something that could be temporary that help me out, or it could mess me up. Because if they don't know, they're going off of symptoms and that's not their expertise. I don't want to tell you something that's gonna mess me up.
Right, right. Of course, of course. And I agree. Like I said, we all have our scope for practice. So, like more mood disorders and things of that nature, they do refer out to us and things because they treat, I believe, depression, anxiety. I have some of them that really don't treat ADHD unless it's like the actual physician. But for the most part, they transition their care over to us for us to manage it.
Okay, okay. Now, let's see. You have a couple of offices that you practice out of.
Well, I did have one that was what was that area? Champion Forest. I'm no longer there. I'm more at the office at Katie and then my home office.
Okay, okay, okay. So, and you see clients virtually mainly.
Yes, virtually, and then I'm licensed in Texas, New York, Nebraska,
Okay.
Colorado. So I see those virtually as well.
So you all over the globe, so to speak.
Now I have a few, not all over, but I have a few where I'm helping. I worked in New York for years. That was actually one of my first well, I'll say Nebraska was, but like for a longer period of time, New York was one of my longer telehealth positions.
Okay, okay. So my main question here: how do you prioritize your own mental health? Because I know when people are people, but I do know that people have unique things they bring with them, and certain regions and cultures have some unique stuff.
Hmm.
And I know for me, like my brain, the energy trying to go up and down to kind of match where the people are and get them up or down to where, if somebody's depressed, I'm trying to make certain I'm trying to bring that energy up. If they have anxiety, I'm trying to make certain I'm bringing that energy down. And I know in my 9 to 5, if I'm dealing with crisis, it's like, let me bring this energy down so we can try to bring that sense of calm. And so with having these folks and you doing all this stuff. What do you do for your own mental wellness? What do you do? What's your self care? What are you doing for self care?
Well, I'm making sure I set healthy boundaries for one. That's one thing I learned with having my own clinic. It's easy to work past those office hours or the answer call and, sending emails at 9, 10 o'clock at night, just because you're in your home office. And like I said, I teach too. So I'm having to set those healthy boundaries. Like I'm going to do this time and this during that time and just stand in prayer and scripture and the word, prioritizing time with my family, exercising, taking breaks from technology, and just making sure I protect my time of rest, getting the sleep that I need, because I'm not as young as I used to be, where I could run off those few hours of sleep and still
Ooh,
function.
mercy. Yes.
So just making sure I do that, because I'm like, you can't pour from an empty cup. So we're here to support, our clients. I want to be my best. And so I just want to make sure I protect that time, because I can't teach you on how to set healthy boundaries and to do your self-care that you need to feel better if I'm not doing this. I got to
That
practice what I
part.
preach.
Leading by example. Exactly. Exactly. I've been burned out so many times. The one thing I do with my clinicians that I supervise, I'm like, self care, y'all better get it because I ain't got it. Y'all better get it because I'm trying to figure it out. I am trying to figure it out. I think I got it now. I think by now I do. I think I'm trying. And we have to, as you said, what we used to be able to do when we were a little younger, I child. Now, as I've gotten older, Jesus, it's like, yeah, now your body needs rest, your mind needs rest. I hate to tell people no, but sometimes I have to tell them no, and it's not because I don't value whatever their programs or events. It's just, yeah, I got 5 events already scheduled for this month. I need to, yeah, take some time for me. I used
Mhm.
to try to do it all. I did. I'd be everywhere. Because not only do I, have my 9 to 5 in my practice, I do advocate in the community. So I may be at a health fair or a mental health fair, or I may be speaking at something, or I may do a live, some kind of virtual something. And it's like, yeah, my body and my mind is saying, yeah,
It needs a break.
we need to take it down a lot, a lot, a lot. So if y'all listening, if I had to say no, I ain't tripping. I'm just trying to take care of me. Just trying to take care of me. All right. So this has been great. I've learned a little bit more about you, and I hope that the audience can get some more insight into psychiatric healthcare providers and who you are and what you do. You know, kind of going back to the top, how much schooling? Everybody asks that. How do you, what's the route, to become, I should have asked that in the beginning, but I just thought about it. What's the route to do what you're doing?
um, well, I am a family nurse practitioner too. So if I count, let's see, all of the years, I would say about 6 years in total of schooling.
Okay.
Because I started at associate's degree, and then I got my bachelor's, and then I got my master's with my family nurse practitioner, and then I went back and I actually got a postmaster's in education, and then I got another postmaster's in psych. So,
Okay.
and then I went back, like, I think, was it during COVID? Yeah, I believe that year, 2020, and I got my doctoral degree.
Okay. That's what's up. That's what's up. So 6 years, that ain't bad.
Yeah, and it's a lot, but, but
A lot of,
I'm used to being a what they call a professional student.
yeah,
Yeah.
yeah, indeed. But it's good work, and hard work pays off because you're doing what you had set your goals to do.
And I love it. I was speaking with someone before, and they was like, "Well, if you're not doing what you're doing now, what would you do?" And I couldn't think of what
Sure.
what I would do. I was just like, "I'm just supposed to be doing this."
That part, I don't know that I would do anything else. I remember when I was in high school, I wanted to be an attorney. That was my thing, and I did not have the study skills, at that time. But now I learned how to study, and it's like, girl, I ain't got money now, so it ain't, that ain't. People like, it's not too late. With what money, child? Who paying for
Right,
that?
right.
Who is paying for that? But yeah. So the last question we have, what advice would you give someone who's interested in becoming a mental health clinician? So if someone is a nurse or aspiring, maybe we're in our high school program, maybe we're in college, I don't know, and we decide, you know what, I see Dr. Lewis, I want to do that or something similar to what she's doing. What advice would you give people?
My biggest piece of advice is just to never stop learning. If they want to go into the mental health field, it's constantly evolving, and the best clinicians are curious. We remain curious. We continue education. Learn all the new medications that are coming out, and so I'll just say continue learning. Find you an experienced mentor. Ask questions. Let me see, be willing to grow. Sometimes you have to bend and be adaptable to your environment. You never know what you're going to get. Like I worked in inpatient psych, so I've
Yes.
seen some things.
God,
But, I'd also encourage them to just develop their listening skills and just remember that, a patient may not remember the medication adjustment that you made, but they'll always remember how you made them feel.
that part. That part indeed. That part indeed. Well, thank you so much. And the name of your practice is what again?
PMB Wellness stands for Peaceful Mind and Body.
Oh, okay. And you are licensed in, or you're practicing in which states again?
Okay, in Texas, Colorado, Nebraska, and New York right now.
Okay, so if I'm in Colorado, Nebraska, Texas, how can I get in touch with you for an appointment? What can I do? How can I find you?
You can visit my website, which is www.pmbwellnesspllc.com. They can call my office at 346-213-4707. I do have social media, Facebook and TikTok. So they have my company's information on there as well. And I do have an Instagram too. I need to check on it. I forget
Okay.
about that one.
All right. Well, cool, cool, cool. Well, once again, I appreciate you coming and taking this time out on a Friday evening for this Meet the Clinician. I think that you have a wealth of knowledge and expertise that can help people who may be looking for mental health, or maybe they're looking to enter this field, or just maybe curious about anything. And I think having a platform to be able to share that has been a blessing. And again, I appreciate collaborating with you.
Yes.
I can truly say that. And for those of you all who have joined us on TikTok and all the other socials, thank you so much. If you are just tuning in and you missed the whole thing, you can catch the replay on YouTube, Larneka L, and give us a couple weeks. It's going to be on Spotify, Apple Podcasts, and all the others, Pandora, all the others. So again, Dr. Lewis, thank you so much for joining us. And you all be blessed and have a good Friday evening.
Thank you for having me. And thank you all for listening.
All right, so we're going to